Have you ever wondered what secrets your body is hiding from you right now? Every day, millions of people go in for routine checkups and are handed a little kit with a very intimidating name, the Fecal Occult Blood Test. Occult simply means hidden. This is a laboratory test designed to find microscopic traces of blood in your stool, blood that is completely invisible to the naked eye. But here is a massive reality check that most people never hear. If you look in the toilet bowl or on the toilet paper and you already see blood, this test is absolutely useless for you. You do not need a lab to tell you that you are bleeding when you can already see it yourself. Yet for the millions of people who do not see anything wrong, this test is often held up as the ultimate shield against gut issues and colon cancer. But is it really? What if I told you that relying solely on this hidden blood test could be one of the most dangerous gambles you can make with your health? Today, we are going to expose the truth about the Fecal Occult Blood Test, why it is so wildly misunderstood, and why trusting it blindly might be giving you a very dangerous false sense of security. So, how does this test actually work? The concept is pretty straightforward. You collect a small sample of your stool at home, send it off to a laboratory, and technicians use chemicals or antibodies to hunt for the tiniest trace of hemoglobin, which is a protein found in red blood cells. But before you even collect that sample, you have to go through a preparation phase that reveals a lot about how incredibly fragile and sensitive this test really is. Most laboratories will hand you a strict dietary list that you have to follow for at least 3 days before taking the test. You are usually told to completely avoid red meat. You might also have to cut out certain proteins, specific raw vegetables, and even some seemingly harmless condiments. Why? Because the test is easily confused. If you eat a juicy steak, the animal blood in that meat can travel all the way through your digestive system and trigger a positive result. Think about that for a second. If simply enjoying a steak dinner or eating the wrong vegetable can taint the sample and make the lab think you are bleeding internally, that is a huge red flag regarding the test's overall accuracy. It is highly volatile. It is easily influenced by outside factors. And this extreme sensitivity is exactly why the results, whether they come back positive or negative, require a lot of context to actually mean anything. It is not a magic 8-ball that just says you are sick or you are completely fine. In fact, let us talk about what happens when the laboratory calls you and says your test came back positive. Hearing that your fecal occult blood test came back positive is terrifying for most people. Your mind immediately jumps to the worst-case scenario. You hear the words blood in the stool, and you instantly think colon cancer. But before you let panic take over, you need to understand the false positive trap. A false positive means the test accurately found blood, but that blood has absolutely nothing to do with a life-threatening tumor. Let's break down exactly where this mysterious blood might actually be coming from, starting from the very top of your body. Imagine you had a bad cold recently, or severe allergies. You experienced intense coughing fits or violent sneezing. The sheer force of a harsh cough can cause microscopic tears in the delicate lining of your throat, your larynx, or your esophagus. These tiny microtears might release just a single drop of blood. You swallow it without ever knowing. That microscopic drop of blood survives the long journey through your digestive tract, ends up in your stool, and triggers a positive result on your test. You don't have cancer, you just had a bad cough. Moving a little further down, let's talk about your stomach. If you suffer from gastritis, stomach ulcers, or acid reflux that causes esophagitis, the lining of your upper digestive tract is irritated. That inflammation can easily cause microscopic oozing of blood. Again, that tiny amount of blood travels down, gets mixed into the sample, and the lab flags it as positive. You don't have a tumor, you just have some stomach irritation. But the most common culprits are actually found right at the very end of your digestive tract. Let's talk about hemorrhoids. It is estimated that almost everyone will experience some form of hemorrhoidal disease in their lifetime. Even if you don't have massive, painful flare-ups, A tiny internal hemorrhoid can easily shed a microscopic amount of blood when stool passes by it. The same goes for an anal fissure, which is essentially just a tiny paper cut on the edge of the anal canal caused by passing a hard bowel movement. You also have diverticular disease, which are tiny pouches in the colon wall that are extremely common as we age. When they get even slightly irritated, they shed invisible blood. Now, speaking of hard bowel movements and gut irritation, if you constantly feel bloated, sluggish, or struggle to go to the bathroom regularly no matter what you try, pay very close attention to this. You can actually empty your bowels twice as fast and completely restart your digestion without eating massive amounts of fiber, following restrictive diets, or buying expensive probiotics. There is a bizarre 8,000-year-old underwater gut superfood that works wonders. By adding just one single pinch of this to your routine, you can naturally flush out up to 10 pounds of toxic poop that is actively clogging your intestines. I highly recommend watching a short, eye-opening presentation about this science-backed technique. Right now, grab your smartphone, open the camera, and point it at the QR code on the screen to watch the video. If you're watching this on your phone, don't worry. I have also pinned a direct link at the very top of the comments section below. Check it out to finally enjoy a light, healthy, and comfortable digestive system. So, looking back at all these common gut issues, do you see the pattern here? A positive fecal occult blood test will pick up the throat tear, the stomach ulcer, the hemorrhoid, the fissure, and the diverticula. Think of this test like a very cheap, overly sensitive smoke detector in your house. When the alarm goes off, it might be a massive house fire, but 9 times out of 10, it's just someone burning toast in the kitchen. The test is completely blind. It cannot tell you where the blood came from or why it is there. So if you get a positive result, take a deep breath. It is not a cancer diagnosis. It is simply a signal to investigate further. But what happens if the test comes back completely negative? That is actually where the real danger lies. When you hand in your sample and the lab calls to say, "Great news, your fecal occult blood test is completely negative," the natural reaction is total relief. You feel like you just received a get-out-of-jail-free card for your health. But this is exactly where the test becomes genuinely dangerous, creating the illusion of a false negative. To understand why this happens, you have to understand the basic biology of how a tumor actually behaves inside the intestines. Many people imagine that if a cancerous tumor is present, it acts like a broken pipe, constantly leaking blood 24 hours a day, 7 days a week. But that is simply not true. Tumors are highly unpredictable, and they bleed intermittently. A tumor might shed a microscopic amount of blood on a Monday, and then completely stop bleeding on Tuesday, Wednesday, and Thursday. So, what happens if you happen to collect your stool sample on a Wednesday? Your sample goes to the lab, the technicians run their chemicals, they find 0 traces of hemoglobin. The report comes back 100% clear, but the tumor is still sitting right there inside of you, growing silently. It just didn't happen to be bleeding on the exact day you took the test. This is the dangerous trap of the false negative. A patient receives that clear result and feels a massive false sense of security. Because the paper says they are fine, they might ignore subtle warning signs in their body. They might put off scheduling a real comprehensive checkup for years, thinking they are totally protected. By the time the tumor finally causes severe symptoms, precious time has been lost. A negative hidden blood test does not guarantee a healthy colon. So, this brings up a very logical question. If this test is so prone to false positives and so dangerously susceptible to false negatives, why is it still prescribed everywhere? Why is it pushed as a standard procedure? It all comes down to public health economics. Imagine a government or a massive healthcare system trying to screen millions and millions of citizens. The reality is that not everyone has the financial means, the insurance coverage, or the geographic access to see a specialist. Not every small town has the medical infrastructure to perform thousands of high-tech procedures. Because of this, The Fecal Occult Blood Test serves a purpose. It is incredibly cheap, it is easy to distribute, and it can be done in the privacy of your own bathroom. It is a wide-net, low-cost screening tool designed for massive populations. In a public health context, doing a flawed test is better than doing absolutely nothing at all. But you are an individual, not a public health statistic. If you want true preventive care and absolute certainty, you cannot rely on a cheap piece of reactive paper. You need the undisputed gold standard, the colonoscopy. Unlike a blind stool test, a colonoscopy involves a direct visual inspection of your colon. It doesn't guess, it actually sees. And more importantly, it can find and remove precancerous polyps before they ever have the chance to turn into a tumor. The golden rule is this: you need to schedule your first colonoscopy at age 45. However, if you have any family history of colon cancer, you must push that timeline up and get checked at age 40. And if you are experiencing severe, alarming intestinal symptoms, age no longer matters. Whether you are 25 or 35, you need to demand a colonoscopy immediately. We easily spend thousands of dollars on superficial things, new smartphones, expensive clothes, or taking out heavy loans for cars. Yet, when it comes to our internal health, we suddenly look for the cheapest, fastest shortcut. Do not treat your health as an area to save a few bucks. Cutting corners financially on a proper medical exam is simply not worth your life. Ultimately, your health is your absolute most valuable asset. Don't leave it up to chance, and please do not rely on half measures that only give you a small piece of the puzzle. The Fecal Occult Blood Test might be a starting point for some, but it should never, ever be your finish line. If you found this breakdown helpful and want to keep learning the actual truth about how your body works, make sure to hit that like button. Don't forget to subscribe and turn on the notification bell so you never miss out on the health facts you actually need to know. Take charge of your health, demand the right tests, and I will see you next time.